am Dr. GPV Subbaiah. I'm a spine surgeon. I head the department of spine surgery at Sunshine Hospitals, Hyderabad. I did my MBBS in Vizag at Andhra Medical College. Then my MS in orthopedics was at Guntur Medical College. Then I did my fellowship in spine surgery at various centers in Europe for well over a period of 5 years. I had extensive training in spine surgery. Then came back to India, started practicing spine surgery. I have an experience of over 7 years in spine surgery after my fellowship. Then during my MBBS, I got 13 gold medals. I was the best outgoing student of Andhra Medical College. During my MS days, I stood first, university first, NTR University of Health Sciences. Then my fellowship. We have quite a few research interests. We have some basic research interests in stem cells in spinal cord injuries, stem cells in disc regeneration. We have been practicing spine surgery, joined Sunshine Hospitals recently. Then we started an exclusive spine center known as Sunshine Spine Center. And this spine center is unique in the sense that this is the first of its kind, the spine center. No one has a standalone spine centers in India. And this spine center is established with the idea of providing all spine services under one roof. We are a group of spine surgeons. We are a group of 5 spine surgeons. I head the department of spine surgery with a group of physiotherapists, rehabilitation specialists, and a pain specialist as well in our team. So we provide all the services in spine surgery, ranging from conservative treatment to the pain treatment and various modern surgical interventions. These modern surgical interventions include minimally invasive spine surgeries. We do a lot of deformity corrections, spinal deformity corrections like scoliosis and kyphosis. And the other thing is, we are recognized as, the Sunshine Spine Center is recognized as the center of excellence in a procedure called kyphoplasty by Medtronic Academia, the university in US, for the first time in South Asia. This is a great honor for the Sunshine Spine Center. So we perform the kyphoplasties, vertebroplasties, the minimally invasive spine surgeries, the pain procedures, and then the rehabilitative services, all under one roof at Sunshine Spine Center. We have quite a few basic research interests. We are working on the proteomics of disc degeneration, proteomics of the synovial fluid in osteoarthritis of the knee. And then we are also working on the genomics of various spinal diseases like degenerative disc disease and the osteoporosis. And the other research area where we are working on is the role of epidural clonidine in low back pain and sciatica. We are also looking at disc regeneration using gene therapy. These are all very latest, current, cutting edge research technologies we are trying to pursue. First patient, of course, is in India with a big, frankly speaking, it's a big surgery on the neck, cervical spine. The patient had a tuberculosis of the cervical spine with weakness of both the upper limbs and lower limbs. That's my first surgery in India. So we did a huge surgery on the neck. We decompressed the spinal cord, did a big fixation of the cervical spine, and luckily for me, the patient has completely recovered from the weakness of both the upper limbs and lower limbs. He is walking, still comes to me once in a while just to say thank you to me. It feels good to be serving people, especially in a very complex area like spine surgery. And it's not many people, when there are not many spine surgeons in India, so very few people, qualified spine surgeons. And it's very nice to be delivering good quality spine services to the patient. It's difficult to say, but my nature is probably to pursue the challenges. And spine surgery is, of course, one of the most challenging surgery in medicine. So that made me to pursue spine surgery, and it's nice to be excelling in this field of spine surgery. I know it's part of the game as a doctor. I miss out quite a few family occasions, even the celebrations quite a bit. But whenever I find time, I try to make up for whatever I lost lost before. So I try to spend my free time with the family and my friends. It's really scary actually, but my first surgery was done under the supervision of one of the most eminent spine surgeons in the world. So that way, I know there is someone who is backing up. So the fear factor was definitely less. But the other thing is, one of the best surgeons in the world is watching me operate. So thing is, it's a mixed feeling. I don't have any kind of fear complex, but on the other hand, one of the top surgeons is watching me how we operate, how I am operating. So yeah, that made me feel little nervous. But my first surgery went really well. So without my boss intervening in between, so it's a great feeling. The misconception among the public is that the spine surgery is, the results of spine surgery are very poor. It's actually on the contrary, results of spine surgery, if well done, if the patients are nicely selected, if the patient selection is good, and if it is nicely executed, the results are extremely good. You get nice results up to 90%. And in medicine, if you get results more above 70%, you say that procedure is extremely good. So if you go to a proper spine surgeon and if we do the procedure really well, you get the benefits up to 90%. So this is a pure misconception among the public that the results of spine surgery are poor. And the other misconception I keep hearing from my patients is that once you undergo a spine surgery, people say you might get paralyzed. So this is actually a great misconception again. So the possibilities of paralysis are extremely low. The other thing I would like to mention here is at Sunshine Spine Center we have an equipment called neuromonitoring. This helps me to monitor the activity of the nerves during surgery. And if I am entering into the danger zone, this machine tells me that you are going into the danger zone. So that gives a lot of safety to the patient, almost 100% safety to the patient. So these two misconceptions I keep hearing from the patients. I take this opportunity to tell the public that spine surgery is safe, especially with the equipment like neuromonitoring, and the results are definitely much better. Most of the back problems, especially the low back pain and neck pain, people say, now we say it's a lifestyle disease, low back pain and neck pain. And the lifestyle, we don't exercise well. You come home, probably get up in the morning, have breakfast, go to the office, come back home, probably watch TV and lie down. We don't have any exercise. Do exercises regularly. And smoking can cause a lot of back problems, especially low back pain. And if you quit smoking, do regular exercises, you can probably avoid most of the back problems. It's again, many of the people say it's the females who suffer from low back pain most. It's actually, if we look into the mixture of patients I see, it's actually equal in both males and females. So there are some peculiar problems to females, there are some peculiar problems to males, but all in all, the back problems are equally common among men and women. Most of the problems we see in our practice, day-to-day practice, most of the problems are degenerative. Degenerative means aging changes. As the age advances, there are quite a few changes in the lower back, the neck. All these changes can cause low back pain and neck pain. So as I mentioned, regular exercises, quit smoking if you are smoking, away from smoking, and eat healthy food, calcium rich food like the green leafy vegetables, milk, seasonal fruits. If you do these three things properly, regular exercise, quit smoking, proper food, probably you avoid most of the back problems. We at Sunshine Spine Center at Sunshine Hospitals provide the safest spine surgery to the patients, especially with the modern equipment we have. So our tagline is, whatever we do, the surgery is going to be safe. this safe spine surgery.